Good evening. Welcome to Thought Provoking Time with Bob. I'm Bob, and I will be your evening's coordinator on our journey as we create some thought provoking topics this evening. These topics that you are about to hear could make you angry, could be thought provoking. It could make you excited for the change that you are going to see in the emergency medical service and that field that we provide services into. So, disclaimer, these are all opinions. So what you're about to hear is one man's opinion about subjects that are affecting our current day EMS providers. So tonight's topic: acronyms in EMS. When you guys start EMT class, what is one of the first things that they require you to learn? Sample, OPQRSTI, DCAT BTLS. Possibly if you were back in the early part of EMT class, you might have learned CHAMPS RN. You might learn AVPU, sludge. Acronyms are everywhere in EMS. Now let me ask you something. When it comes to patients, we use these acronyms to remind ourselves as a thought-provoking tool for ourselves to cue card, for like a cue card for us to work through our patient assessments. However, sometimes we go a little too far with our acronyms. For instance, OPQRSTI. What do we use OPQRSTI for? We use OPQRSTI primarily to assess pain. When we are assessing pain, how can we use OPQRSTI for anything else besides pain? Can we use it for an asthmatic? Yes, we could use onset. We could use what makes it better or worse. We could use, can you describe your asthma attack to us? Does your asthma attack radiate anywhere? On a scale of 0 to 10, 10 being the worst, how would you rate your asthma attack? Since I've got here, has it gotten better or worse? Or have you done anything for this asthma attack? It works, but you have to adapt it to what you're using. Why do we make people really understand OPQRSTI when we then turn around and say, hey, you're not asking the right questions for an asthmatic. You need to be asking, have they used their inhaler? Have they been hospitalized for their asthma? Have they had a constant asthma attack like status asthmaticus? These things are what we really should be teaching our students. We really should be teaching our providers in the street the questions they really need to be asking instead of teaching these acronyms that provide a one-track mind that nobody critically thinks. We need to be critical caregivers that are not cookbook that we follow 1, 2, 3, 4, 5, and 6. We need to be able to work through these situations and be able to be flexible with what hits us and be able to ask those questions, be able to know what we need to ask. For instance, you have a gentleman who falls and hits his head. You could ask OPQRSTI. That would work, but what if he has an altered mental status? That's probably not going to work very well. So what questions do you need to know? Did he have a loss of consciousness? Is he bleeding from the back of his head? How long ago did it happen? Does he have pupil changes? Those are things you want to know. But OPQRSTI is not going to help you. Sample's okay. I like sample. It's fine. However, I think we teach acronyms way too much, and we are pushing them on students to make them learn it. Come join EMS. We'll teach you all the acronyms you don't know now so that you can know them when you get out of EMT school and be able to use them on the street. When was the last time you remember using the acronym CHAMPS RN? How many of you remember CHAMPS RN? CHAMPS RN, for those of you who don't know, is the different types of shock. Now, we have 4 classifications of shock, but we also have different types of shock. So, cardiogenic, hemorrhagic, anaphylactic, metabolic, psychogenic, septic, respiratory, and neurogenic. Okay, CHAMPS RN. It works and it helps people remember it because it's a mnemonic. But we make people test on these. It should be a teaching aid, not a testable material. We should not be requiring people to be able to recite these. We should just require them to know what they need to be looking for. Too much of acronyms creating the test. We should be using acronyms as a way to assist a student. For instance, acronyms have gone on to go as far as to be used to make patients look bad in bad light. For instance, have you ever heard of GOMER? This one just makes me curl up inside and just want to die, because GOMER means get out of my emergency room. Okay? Does a patient know what you're talking about? No. They have no clue. But when they walk into that emergency room, or you're walking in and you say, hey, we got another GOMER for you, they have no clue. But you are degrading that patient. Okay? Another one is you have an elderly patient, and you know elderly patients are very near and dear to my heart. And we talk about TMB, too many birthdays. Okay? And there's funny ones like Ford, found on road dead. But for those who are Ford lovers, that kind of hurts a little bit, but it's a car, for heaven's sakes. And ones that are okay, AVPU, RICE. I mean, acronyms are everywhere, and I feel like we are using them way too much. But understanding that, I think acronyms have a place in EMS. I think they work well, but we also need to be careful to not swing the pendulum the other opposite way. And instead of using them as a teaching aid, we've gone so far as to make them a requirement that you have to know these. For instance, in EMT class, you have to take quizzes on sample, OPQSTI, and DCAT-BTLS. You're going through a patient assessment, and they say, I am looking for DCAT-BTLS. And everybody knows what they're saying. But really, do the students know what they're saying, or are they just saying what they've been taught to say? Are we teaching them to repeat phrases like acronyms? I'm going to do sample, I'm going to do OPQSTI, I'm going to do DCAT-BTLS. Or are we actually teaching them to be caregivers and getting in there and critically thinking, what kind of questions do I need to ask this patient who's an asthmatic? What kind of questions do I need to ask this person who has chest pain? What kind of history could this patient present with, and what kind of questions do I need to ask? So be thinking about that, this thought-provoking thing of, do we really need acronyms in EMS or not? I've said my part. I'd like to hear from you, what your thoughts are. Have a good evening, and be safe this evening. We'll talk to you later.